Hi guys, welcome to our podcast Health Unplugged, our superheroes. So today we are going to talk on a very important topic in our normal people life, diabetes, and how Ayurvedic treatment is going to help in reversal of diabetes. So with that topic in mind, I would like to welcome Dr. Kaushik Solanki, MD in Ayurveda. He has 15 years of experience in Ayurvedic medicine. He has also received many awards and accolades. He is a CMO and director of Vedic Clinic, Ayurvedic Clinic, and Panchkarma Center. So, thank you, doctor, for making time and coming here. And we would like you to have a detailed discussion on how we can reverse diabetes with help of Ayurvedic medicine. So, Dr. Solanki, to begin with, firstly, our viewers, our listeners would like to know how how modern treatment is different from Ayurvedic treatment in terms of treating diabetes.
Okay. Yeah. First of all, I'll let you know what is diabetes
Yes.
as per Ayurveda point of view and as per modern point of view. Okay. As per modern point of view, there are three categories. Ideally, you are pre-diabetic and you are actual diabetic,
Okay.
and you are dealing with diabetes and along with the complication of diabetes.
Okay.
Pre-diabetic means when your HbA1c levels, एक blood test आता है जिसको हम HbA1c बोलते हैं, तो it is near about 5.5 to 6.6. अगर उसके ऊपर है then you are pre-diabetic.
Okay.
That is be treated with your lifestyle management. Okay, and it does not need any medications. And from 6.5 and above, you are labeled as actual diabetic.
Okay.
So there are two types of diabetic 1 and diabetic 2. तो अभी जो हम सिनेरियो देख रहे के मोर ऑफ द पॉपुलेशन में जो डायबिटीज दिख रहा है दैट इज टाइप 2 डायबिटीज.
Okay.
ओके, टाइप 1 डायबिटीज मोस्टली जुवेलाइन डायबिटीज होता है, 5 ईयर्स 6 ईयर्स से डिटेक्ट होता है, एंड 23-24 ईयर्स में भी कभी कभी आपको दिखने में आ जाता है. तो नाउ वी आर गोइंग टू टॉक टुडे ऑन टाइप 2 डायबिटीज ओनली.
Okay. So thank you, Dr. Kaushik. That was really nice insight
Yeah.
on type 2 diabetes.
Yeah.
Now, my next question is how the Ayurvedic treatment is going to help in the reversal of diabetes, and what are the signs and symptoms that you look for, or red flag that you look for while you want to treat diabetes in an Ayurvedic format.
Yeah. So while treating patients in Ayurveda way, what we do, we categorize the patient in as I have spoken earlier in 2 to 3 categories. So pre-diabetic, actual diabetic, and which are along with the complications.
Right.
Complications like diabetic nephropathy, diabetic neuropathy. Okay. So these are the third category. Okay. We will talk one by one on stage 1.
Okay.
Or pre-diabetic. Pre-diabetic means when your HbA1c level are near about 6.5, and it is what we can say borderline diabetic. So it can be treated with your lifestyle management. तो उसमें आपको ज़्यादा मेडिसिन नहीं लेनी पड़ती है.
Okay.
So what we do, we have planned our clinic, our Vedic Ayurveda clinic has planned detoxification therapies. So उससे आप विदाउट डिटॉक्सिफिकेशन भी आप वो लाइफस्टाइल मॉडिफिकेशन भी ठीक हो सकते हो. अदरवाइज सम योर डाइटरी मॉडिफिकेशन से आप ठीक हो सकते हो. When you are actual diabetic, for example, there are many patients, there are many populations में जिसमें they are taking diabetic pills, they are on
Okay.
insulins also.
Okay.
Okay, and insulins and diabetic medicines लेके भी उनको ट्रीट होना है. तो पहले अभी तक ये कॉन्सेप्ट था नहीं कि डायबिटिक भी आपके बॉडी से जा सकता है.
Yeah.
ये जा
That's
सकता
what.
है. हाँ, that is the main point के we have a misbelief कि एक बार जो बीमारी आ गई वो चिपक गया तो चिपक. It is not like that. It is stuck to your body and you cannot get rid of that. It is
Okay.
not like that. You can get rid of that, and definitely we are specialized in that only ki how to reverse your diabetes, how to get back to your normal life, and what we are aiming without any medicines, without normal Ayurveda medicines, without any allopathy medicines, and without any insulin. You can live a normal life along with your normal diet, diabetes free diet life.
Okay.
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 Along with the Ayurveda, there are some therapies which we'll talk further.
Okay.
Okay.
So now I want to say that Dr. Kaushik has already cleared our doubts on the myths and the misconceptions related to diabetes. So my next question is, what are the root causes that you can touch base upon in case of diabetes patient, and how the reversal therapies are planned? As in, what are the main things that you look for before planning a detoxification treatment?
Yeah. First of all, as you asked, what are the cause of diabetes? So first basic cause is your very bad lifestyle management.
Okay.
Okay. what do you mean by lifestyle management? Sedentary lifestyle. Sedentary lifestyle means जित आपकी कैपेसिटी है 10x की, एग्जांपल है हमारी हर एक की कैपेसिटी होता है ना, वी टेक अ कार,
Right.
it has a limit 80 kilometers per hour, like Ferrari
Correct.
has a more, so it is like that. So when my body or your body has a capacity of 10x for example,
Okay.
okay, and you are over dumping your body, मतलब आप लिमिट से ज्यादा उसको फीडिंग करा रहे हो, what will happen? It will accumulate more and more toxins, more and more fats in your body, and
Right.
it will convert you into obesity.
Right.
And then the sedentary lifestyle, no workouts, no healthy diets, more of fat and carbohydrate diets, what will they do? They will increase the visceral fat. What I want to clear you, what is the
Okay.
visceral fat? अभी डायबिटीज होता क्यों है, ये डायबिटीज रिवर्स होता है तो कैसे होता है? आई जस्ट गिव यू शॉर्ट एग्जांपल हाउ वी आर गोइंग टू वर्क. जब ये मैंने बोला कि आपकी ये सब लाइफस्टाइल आप लेते हो, जब भी आप ये डाइट लेते हो, तो उससे क्या होता है कि आपके जैसे फैट एक्सटर्नली बढ़ता है, तो एक विसरा, विसरा मतलब आपके इंटरनल ऑर्गन्स, व्हाट इट कम्स लाइक लीवर, पेनक्रियास, पेनक्रियास वो बीटा सेल से जहां से इंसुलिन निकलता है.
Right.
ओके, तो जब ये फैट एक्सेस हो जाता है तो आपके पूरे विसरा में, मतलब आपके इंटरनल ऑर्गन्स जो है उसमें एक्यूमुलेट होना स्टार्ट हो जाता है. और ये हो गया तो क्या होता है कि आपका नॉर्मल इंसुलिन लेवल जो बढ़ता है, नॉर्मल इंसुलिन जो सिक्रेट होता है वो आपके बॉडी में नहीं जा सकता है, तो उसके कारण आपका शुगर उसको इनटेक नहीं, क्योंकि शुगर इनटेक बॉडी में जब भी जाएगा जब उसके साथ इंसुलिन अटैच होगा. और वो एंट्री तभी करेगा जब आपके विसरा क्लियर है. नाउ यू आर हैविंग वेरी सेडेंटरी लाइफस्टाइल, आप ना कोई वर्कआउट हो तो आपका फैट बढ़ रहा है. फैट बढ़ने से क्या होता है कि आपके लीवर्स है, आपके पेनक्रियास है, जिधर से इंसुलिन का इंटेक होना चाहिए मस्कुलर लेवल पे, वो एंट्री नहीं मिल पाएगी. एंड सो you are land up, this is the pre-diabetic stage. So we modify your lifestyle. तो इससे विदाउट मेडिसिन से अगर आपका विसरा क्लियर हो गया, आपके उसके ऊपर का जो लेयर है फैट का वो क्लियर होगा, डेफिनेटली विदाउट एनी मेडिसिन, विदाउट एनी एफर्ट, विथ योर गुड लाइफ स्टाइल एंड योर डाइट, डेफिनेटली आप ये प्री डायबिटिक स्टेज में से नॉर्मल पेशेंट में आ सकते हो, नॉर्मल हेल्दी पर्सन में आ सकते हो. व्हेन यू आर इन डायबिटिक, तो इसके साथ हमारे कुछ डिटॉक्स थेरेपी होती है, विच आर वेरी बेसिक थेरेपीज, लाइक we first of all tell you what to eat and what not to eat.
Okay.
So basic वो रहता है जो मतलब आपका घर का खाना है वही खाना है, बट कैसे खाना है, कभी खाना है, एंड अलॉन्ग विद दैट वीकली वंस हम एक डिटॉक्स थेरेपी देते हैं.
Okay.
एंड अलॉन्ग विद our medicines and along with your ongoing medicines which you are taking for your diabetes, any it might be metformin, glimepiride or insulin जो भी आप ले रहे हो, along with your HbA1c levels और sugar levels, हम उसको धीरे धीरे टेपर ऑफ करते हैं. आपका भी मेडिसिन हम बंद करके then we'll see, and when everything is going on good like detox therapy and our medicine and your allopathy medicine, when they are going slowly and still your diabetes level, your sugar levels are on a very good scale, then definitely we switch the medicines to Ayurveda and then on a normal lifestyle and normal diet. So no medicine is needed in such kind of patients.
Okay. So thank you again for clearing our doubts on lifestyle management and
Yeah.
how it is different from the modern medicines.
Yeah.
But now I want to know how the reversal therapy works here. Like, what are the basis of Ayurvedic reversal therapy? Like, in terms of what are the detoxification cycles that you enroll the patient for?
Ideally, we give a basic cycle of 3 months.
Okay.
3 months. For example, patient X or you have come to my clinic for getting a diabetes reversal therapy. The first thing what we do 3 kind of test, which very less doctor, very less clinic does. First of all, we'll check the insulin test, which is a test to check the how much amount of insulin it is secreted from your body in your bloodstream. तो आपके ब्लड में कितना इंसुलिन है, फर्स्ट हम वो देखेंगे.
So that's a basic test. जो
No,
blood
no,
test
that is not
करते
a
हैं वो?
basic test. It is a higher test, but it is test to get our very good idea कि आपके बॉडी में इंसुलिन सिक्रेशन कितना है.
Okay.
To see the beta cells which are healthy or hampered on your pancreas.
Okay.
Insulin test we do. Second is your HbA1c levels, which is routinely done by other clinics. Why insulin? Why we do our specialties? We do insulin test. We do insulin test to check के आपका अभी इंसुलिन लेवल फॉर एग्जांपल लोअर रेंज में था. That after getting the reversal therapy, if it is increasing in a very good level, जो कि एक अच्छे लेवल में चाहिए, but it is in normal range, then that is a very good sign that your body is healing. Now your body does not need any medications, no Ayurveda, no allopathy, no any detox therapy, because your body is healthy and it is secreting insulin in a very good way.
Good.
अब ये हमको कभी पता चलेगा when I know your actual insulin level.
Right.
So that is the very peculiar thing which we do, and we work on that only to reverse your beta cells, to reverse your pancreas cells which are hampered, जो भी उसकी एक्टिविटी कम हो गई है. We increase the activity of the beta cells which our with our program detox therapy and
Okay.
our and customized medicine. अभी हमारा क्लिनिक का ये खासियत है. What we do when there are 10 patient of diabetes, so we check every patient accordingly and we customize the medicine as per the patients. तो 10 डायबिटिक पेशेंट है, हर एक का प्रकृति अलग है,
Okay.
हर एक का बॉडी टाइप अलग है, हर एक का आहार, हर एक का डाइट अलग है. कोई साउथ इंडियन पेशेंट है, ही इज ईटिंग मोर ऑफ राइस,
Right.
नॉर्थ इंडियन ड्रिंक मोर ऑफ चपाती. ओके, सो डाइट अलग है, उनका रहन सहन अलग है, लाइफस्टाइल अलग है. तो वी कस्टमाइज द मेडिसिन एज पर द पेशेंट, and when we give such customized medicine to the patient as per prakriti and nadi, then the results which we see is very good, and results are seen not verbally, it is seen in your reports.
Okay.
And your body will say what are you feeling, good or
Okay.
bad.
So here, Dr. Kaushik already told us about how the prakriti of a patient or an individual is going to affect the overall treatment, and also how the nadi parikshan works in terms of
Yeah.
Ayurvedic medicine. Now, what I want to know, or what our viewers will want to know, is how the underlying conditions like, say, hypertension or
Mhm.
obesity or thyroid, these are going to get affected in terms of the reversal therapy, or in terms of the detoxification that is carried out. Means, is it going to affect in negative way or positive way?
Yeah, very good question, ma'am. There are query not in you, but many patients ask this. First of all, when there is a diabetes, it is a what we can say king of all diseases.
Yes.
So diabetes does not come alone. It
Hmm.
comes with hypertension. Where the
Correct.
patient mostly comes, which we see in a clinic, they are aligned disorders like hypertension, thyroid disorders,
Right.
lipid profile derange. Okay, so definitely when your body has been detoxed by a panchkarma specialization, panchkarma therapy, then we have seen the good results in your hypertension also. Like जिसका बीपी पहले बहुत शूट अप रहता था, टेकिंग हायर डोज ऑफ मेडिसिन, बॉडी डिटॉक्स होने से, क्लिनजिंग होने से बाय आवर पंचकर्मा थेरेपीज, डिफरेंट काइंड ऑफ थेरेपीज, तो योर हाइपरटेंशन मेडिसिन ऑल्सो गेट रिड्यूसेस.
Okay.
कभी कभी कोई पेशेंट ऐसे जो न्यूली डायग्नोज हुए हैं हाइपरटेंसिव, और उनका जो अगर आपका डिटॉक्स अच्छे से हुआ है, तो डेफिनेटली दर मेडिसिन ऑल्सो आर टेपर डाउन और स्विच ऑफ.
Okay.
बंद भी हो सकते हैं. तो डेफिनेटली इट इज गोइंग टू हेल्प यू इन अ मेनी वे. What detox, I tell you what detox means. For
Okay.
example, we take a car or we take anything, कोई भी gadgets लेते, AC लेते, कुछ भी लेते, we annual maintenance होता
Okay.
है ना, तो हम उसका मेंटेनेंस करते हैं. We are living entity, we are a body. तो अभी तो you know everything is pesticide, and even the air which we inhale, it is also very polluted, pollution.
Right.
तो where does it goes, आपके बॉडी एक्यूमुलेट करेगा. आपने कभी नहीं सोचा ये सब भी फ्लश आउट होना चाहिए, सब भी क्लीन होना चाहिए.
Yeah.
ये क्लीनिंग होने नहीं होने की वजह से आपको नंबर ऑफ डिजीज होते थे. व्हाट वी फोकस, वी क्लींस योर बॉडी नॉट इन अ डायबिटिक वे, बट अलॉन्ग विद द अलाइंड थेरेपीज. जैसे कि अभी आप डायबिटिक भी हो, आपको हाइपरटेंशन भी है, और आपको थायराइड भी है, और अलाइन में है, तो हम आपकी डिटॉक्स थेरेपी वैसे ही प्लान करते हैं ताकि आपके अलाइन थेरेपीज भी, जो डिजीज है वो भी ये थेरेपी में इंक्लूड हो, एंड यू गेट रिड ऑफ दिस डिजीजेस आल्सो. डेफिनेटली इट इज हैविंग, मतलब बोलते हैं एक तीर से दो नहीं, यहाँ पे 3-4 जो भी निशान है आपको लग जाएंगे इन अ गुड वे. ऐसा है.
So that's really great to know that one detox therapy or one reversal cycle is going to help all the lifestyle diseases like hypertension, obesity, thyroid, and our king, as doctor said, diabetes. So my next question is, what is the resistance from the patient to switch from the modern medicine to the Ayurvedic treatment?
Yeah. Again, this is a very good question you asked. First of all, there is a very misbelief or rigid belief we can say कि एक बार जो बीमारी लग गई, एंड डायबिटीज अ वेरी बैड थिंग विच वी थिंक, एक बार ये डायबिटीज हो गया तो ये कभी नहीं जाएगा. ओके. तो देर इज वेरी ये मिसबिलीफ की वजह से देर आर सम पेशेंट विच आर वेरी रिजिड के हाउ यू आर गोइंग टू रिवर्सल दिस काइंड ऑफ थिंग, विच इज इम्पॉसिबल. बट वी हैव अ वेरी गुड डेटा ऑफ अ पेशेंट. Okay, we show the data, we show our reviews of the patient, we have a testimony of the patient which are diabetic free.
Okay.
And it is not a blindly game like you have come to my clinic.
Correct.
and I will say you verbally, ma'am, you will got diabetic free. No, it is not like that. It is a very planned treatment. It is a very precise treatment. When you come, I said you previously only, we will do your insulin test,
Right.
we will do your HbA1c test and align test, which it is required. And when we are starting with our therapy, so with our therapy we will do your test again and again. Okay, and along with that we will check your health assessment also. So yeah, with our patient review, with our data of so many patients, we show to the coming patient, and definitely if they are good in recognizing it, then definitely they switch.
Right.
Still, there are very misbelief in population more often. Diabetes cannot be reversed, but we show with our back data and with the proof that no, diabetes has been reversed. Yeah, there are some cases like diabetic complications.
Correct.
Okay, what are diabetic complications? For example, a person is having a diabetic foot, gangrenous diabetic
Gangrenous,
foot,
yeah.
and diabetic retinopathy, diabetic nephropathy. So there are some patients which we cannot say it can be reversible. So there are third category which I was telling. That third category is that kind of patient which can be live a long normal life with minimum dose of medicines.
Okay.
Because this medicine also, the allopathy also medicine, whichever they are taking, it has its own side effect.
I agree.
A side effect on your kidney, liver, definitely they are having side effect. Okay, so we can minimize the risk of the side effect, and we can extend the healthy lifestyle of the patient, whichever is there. And definitely the complications are also well treated. Okay. By Ayurveda with our therapy also, with some pro and cons that depends on patient to patient.
Okay.
Yeah.
So that was great how the testimony or review of patient is going to help the coming in patient to understand how the treatment is different from the modern treatment. Also, it is great to know that the complications related to diabetes are also taken care of, and the lifestyle can be altered or managed to give comfort to the patient. So
Yeah.
that's really nice to know the insight on diabetic treatment. Now, if you could share one live example of how the treatment has helped any of your patients in terms of diabetes reversal or any lifestyle diseases, so that will help our viewer to switch from the modern treatment to the Ayurvedic treatment, or it will also help them to understand what's the difference in treatment and if there are any side effects.
Yeah. So I can give you example of 2 3 patients which have come. There was one patient named X, because we cannot reveal the patient identity. So I will name the patient X, a 44 year male. He was suffering from diabetes, and he was taking insulin.
Okay.
Insulin mixtard on a very higher range. Okay. So along with the oral medicines like metformin, glimepiride, which were there. Okay. Still along with the medicine, he was having very bad complications of like diabetic neuropathy. Okay. So he has concern to his diabetologist. So he was like, now I can increase your insulin level and oral medications, but it is very difficult to you. Better you manage your lifestyle and everything. So he was very much upset. So he was brought to my clinic with our diabetic patient who was healed, who was treated by our clinic. So when he came to our clinic, definitely we have given him all the lifestyle modifications and detox. Now, actual the patient after 3.5 months, the patient HbA1c levels, which were before the therapy 12.5, now it is around 6.4 to 6.5. And these are the all document which we have. We keep the documentation of each and every patient to our clinic to show to other patients also, so they can have a good confidence in them. Right. And definitely they can also get rid of the diabetes which they are suffering from.
Okay, so that was really nice of you to share a live example and how your treatment has helped a lot of patients. So my next question is like a rapid fire.
Yeah.
One food that a diabetic patient should avoid.
First of all, one food should avoid milk and wheat.
Okay.
Why milk and wheat? Because it has a very high glycemic index. So better you should avoid milk and wheat, gahu or दूध. ये बंद करना चाहिए.
Okay. So guys, you know what to avoid if you don't want to have any lifestyle related disease. Secondly, second question I would like to know is the alteration of the lifestyle.
Yeah.
What exactly should a patient alter in lifestyle management?
First of all, get up at a good time.
Okay.
Sleep at a good time. Cut down your what you can say mobile screen level or laptop level. At least having a good sleep and good food. the most important thing is eating habits.
Okay.
For example, you are hungry at 1 p.m., but you are extending it to 3 p.m., 4 p.m., and they are dumping your body with unnecessary things. So it will definitely lead to you in a bad state. So time pe sona, time pe khana, it is a very basic thing what we can do. And third thing, a basic workout, either through yoga, either through exercise. If you cannot do anything, at least 2 to 3 Surya Namaskar per day definitely is going to keep you away from many disorders. 3 Surya Namaskar per day, which we tell to every patients, every which are non-diabetic also.
Okay.
अगर आपको ये नहीं चाहिए obesity diabetic, 3 से start कीजिए, then can increase every one Surya Namaskar every day. So it is a very basic thing which you can do. Yoga is very good.
So as we all heard, Surya Namaskar, yoga or basic workout is the thing that we all should follow for a basic lifestyle modification. Now, so the last rapid fire question is a one line advice to a newly diagnosed patient, type 2 diabetes patient.
Okay. One line advice, modify your lifestyle, diet, and do workouts. At least do yoga, Surya Namaskar.
So as again, workout, yoga, Surya Namaskar and घर का खाना. I
घर का
would
खाना.
tag it as.
बेस्ट है बेस्ट.
So उससे हमारे बहुत सारे problem
Yeah.
solve हो जाएंगे. So doctor, my next question to you is to our topic of discussion, the reversal of diabetes. What we want to know is how in depth you are going to tell us about how you're going to treat the diabetes reversal part with modern techniques and in conjunction with Ayurvedic treatment.
First of all, when a patient come to our clinic, what we do, we categorize, as I said you, in 3 categories. First, pre-diabetic. Second is actual diabetic, and diabetic with complications or without complications. Okay, and with insulin, the patient which are on diabetes medications and along with the insulin. So what we are doing here, detoxification therapy, is there are many panchkarma therapies which we have customized as per the patient. For example, there is basti, uh, different kind of basti therapies are there. For panchkarma therapies are there.
Okay.
Different kind of what we can say, we apply some patch on pancreatic patch.
Okay.
On your pancreas. Why we apply the pancreatic patch on your pancreas? So it can increase the activity of the beta cells of your pancreas, which secretes the insulin in a very normal way. Okay. So these are the specialization techniques which our Vedic Ayurveda use, and definitely this kind of detoxification therapy helps the patient. And it is not like that you have to do detox therapy each month.
Okay.
First of all, there are many misbeliefs. Okay, you have to do detox therapy each month. No, it is not needed each month. It has to be taken once when you are starting your therapy. Okay, so it will be of 7 days, it will be of 10 days, it will be of 1 day also. Depend as per your type, as per your disease. Okay, and along with that, we suggest some basic lifestyle and dietary what we can say modifications. And how I will come to know, or you will come to know you are diabetic free?
Okay.
This is the very big question which every diabetic patient asks. Sir, मुझे कैसे पता चलेगा मैं diabetic free हूँ? So that is the last test which we do is the GTT test, means what, glucose tolerance test.
Okay.
इसमें हम क्या करते हैं, we will ask you to go any recognized lab, otherwise you can come to a clinic, we can also do that test. After when we certified you now you are diabetic free, what is GTD test? We give you a 75 gram of sugar at a time.
Okay.
अब शुगर का पेशेंट है, डायबिटिक पेशेंट है, वो इतना 1-2 चम्मच चीनी खाएगा 10 ग्राम, फिर भी उसको ये होता, तो मैं आपको एट ए टाइम मेरे क्लिनिक में बिठा के या कोई भी आप यहाँ पे जाके लैब में जाके 75 ग्राम आपको हम शुगर खिलाते हैं. जीटी टेस्ट का वही मतलब है, 75 ग्राम शुगर खिला के भी अगर आपके डायबिटिक रिपोर्ट्स नॉर्मल आते हैं, देन वी सर्टिफाइड यू एज अ डायबिटिक फ्री पेशेंट और अ हेल्दी पेशेंट. सो दिस इज द थिंग विच हाउ यू विल कम टू नो, हाई विल कम टू नो. अगर आप 75 ग्राम शुगर खा के भी अगर आपका शुगर लेवल नॉर्मल रहे, एंड डेफिनेटली आर डायबिटिक फ्री. सो दिस इज द स्पेशलाइजेशन व्हाट वी डू फ्रॉम इंसुलिन टेस्ट एंड द फाइनल टेस्ट इज द जीटीडी टेस्ट. सो ये जीटीडी टेस्ट पे आपको भी पता चलेगा यू आर डायबिटिक फ्री, एंड डेफिनेटली वी टू कम टू नो. सो दिस इज द आवर बेसिक what we can say, what our tools, panchkarma therapies, pancreatic patch, and GTT test. So you say you are definitely will come to know you are diabetic.
So I'm sure we have cleared all our doubts regarding panchkarma therapies, what are the different types of tests that are done to understand whether a patient is diabetic free, how those tests are conducted. Now, what we would like to know, sir, is what is the time duration that you give a patient कि आपका treatment हो गया है if you are diabetic free? Is there a fixed time frame?
Yeah. First of all, as I said you, each and every person is different from it. In Ayurveda, it said, Puruksham Puruksham Vikshet means what? Each
Okay.
and every patient is different.
Different.
Each and every individual is different from him.
Okay.
Your fingerprints are different. My iris and your iris are different. So definitely, how we can keep a tag कि आपका डायबिटिक 3 महीने में होगा उनका भी होगा. It is not like that. It depends, but what we have by the experience of this 15 years, what we have seen, कि definitely minimum 3 years, maximum 6 to 8, sorry, minimum 3 months and maximum 6 to 8 months लगता है एक पेशेंट को डायबिटिक फ्री होने में.
Okay.
Yeah, ये एक रेंज है.
Okay.
So you can come in any of the range. Okay. So there are
basically-
patients which have gone diabetic free in 2 to 3 months also,
Okay.
and some are with the insulin resistant patient hai, or with along with insulin and with oral medicines of diabetic. So they have taken a longer duration of 4 to 5 months.
Okay.
We can consider 3 to 8 months.
Okay.
Roughly.
That's really
Yeah.
nice to know. Thank you,
Yeah.
sir. Thank you, Dr. Kaushik, for sharing your insights on Ayurvedic concept on treatment of diabetes and the reversal therapy. So, what we want to know next is how One Health Assist has helped you as a doctor, and how is it going to benefit the patient who are going to use the One Health Assist app and the One Health Assist Health Locker. So, can you show us some light on
Yeah.
that?
Fine. So it has helped me in a very good way. By doctor's point of view, I'll say you, being a doctor and being multiple clinics which I consult, so it is very difficult for me sometimes to manage so many patient data at a time
Correct.
offline, when it is like having a diary or book and writing down. What One Health Assist has done, it has given me a very good ease. Like for example, I am at the clinic 1 and I want to check the data of my clinic 2 patients.
Right.
So I use One Health Assist platform and I get the whole data. कि what his past history was, उसका पहले का रिव्यू ये क्या था, blood reports क्या था, and
Correct.
now what he is suffering from. So it has helped me in a very good way for managing a data of patient of my
Okay.
multiple clinics. So it has helped me in a very good way. A patient point of view, the patient can use One Health Locker. So One Health Locker helps them to save their data. Okay, so in that you can put your reports, you can book your visits online. Okay, and you can consult online. So this One Health Locker help has patients also and to doctors also. So I will recommend, and it can be used, and it helps me a lot, and definitely all doctors should use it. What I
Okay,
recommend.
that's really so. Once again, thank you, Dr. Solanki. That was really great knowing that you are happy with the services at One Health Assist. The platform that you have used has helped you manage your patient data record, and it has also helped your patient. So I'm really glad to know that. So viewers, you can book an appointment for Dr. Kaushik Solanki through One Health Assist platform. He is available for online and offline consultation both. And I would also request all the viewers, all the listeners, if you can go on our website, use our One Health Locker, in like export your data, medical data. It's going to be great to have the record in a digital format. And as doctor आपने जैसे अभी बताया, it has helped your patient to manage their medical record. It's a very good, seamless, very helpful. Please share and subscribe. And until next time, I would like to thank you once again, doctor. It was nice talking to you on
Same to you.
One Health Assist.